So Damon had a very nice question here. Because you have a concussion, you have a lot of traumatic brain injury, which equals a lot of inflammation in the brain. Vyvanse, yes, can be very helpful. A 30 milligram dose of Vyvanse can be sufficient for people. But the thing to note with the stimulants is that the stimulants will actually oftentimes, unfortunately, lead to tolerance. So it's important to take breaks from stimulants, meaning holidays, like on the weekends and things of that nature. So that way you don't develop the tolerance. But if you're developing the tolerance, then you may need to increase the dose if 30 milligrams is no longer effective for you. Max dose is 60 to 70 milligrams. Now, oftentimes that's reserved for adults, with ADHD, and also for binge eating disorder. We go up to 70 milligrams, let's say, if you have that with ADHD. But when we're talking about a concussion and traumatic brain injury and enhancing cognition and memory, we really want to help support the brain and support the brain with healing and decreasing inflammation and improving that. So that's where the omega-3s come in. Omega-3s, lots of research on their effectiveness for treating depression, but also improving cognition and memory. And also with diet, an anti-inflammatory diet can be very beneficial here as well. Now, the other thing I mentioned was getting out in sunlight. So as soon as you wake up, within 30 minutes, and this is for everybody who wants to really utilize, if you're having trouble with sleep or feeling sluggish during the day, get outside within the first 30 minutes, get sunlight, get that sunlight exposure to your eyes. That's going to stimulate the cortisol awakening response, which we want to be active during the day and not at night, okay? So that's key. That helps also with memory, cognition, and focus. Another thing I mentioned was, not to drink like coffee, but like something like green tea, which has a cleaner source of caffeine. And green tea has ECGC, which is an antioxidant, very powerful anti-inflammatory properties as well, which will also help with that traumatic brain injury, as well as with cognition, focus, and memory. So those things are like a must, right? Then looking at the possibility of lithium orotate, and this is something you would want to talk to your provider about. I'm not talking about lithium carbonate, which is the pharmaceutical grade lithium, but I'm talking about the nutritional lithium. Tons of research on lithium orotate being effective for cognition and memory, specifically with Alzheimer's and dementia. But there are a couple studies with TBI, traumatic brain injury, also helping with depression, reducing suicidal ideation. I mean, there's a ton of literature out there on nutritional lithium, but I want you to talk to your provider about it. That goes with all of these, answers to questions. This is all just educational, and you always run everything by your provider first. I'm just giving you like what I would do as a provider in general. But definitely I would look into lithium orotate as well as a possibility to help. Other nootropics that can be utilized, again, if it's not contraindicated, with your care, could be things like rhodiola. Rhodiola can also help improve cognition, memory, and even dopamine. And oftentimes rhodiola can be combined with stimulants to increase their effectiveness. So we would do that if you're at a max dose or something, or you reach tolerance and you don't want to increase the dose. You could use rhodiola to help further improve the dopamine response and that cognition and memory. Antioxidants, something called OPCs, polyphenols, and things of that nature have also been shown to be beneficial for cognition and memory as well. And there's a bunch of other, tons of nootropics if you go down the nootropic path. But I just find sticking to the ones that I've seen work, like the rhodiola and the ECGC, which is green tea, omega-3s, decreasing inflammation, And then there are some OPC products, you know, polyphenol products that we may try. Curcumazole, mine comes, you know, comes to mind with pure encapsulations. That's an OPC product with turmeric, which could also be helpful to reduce inflammation. But I don't like going down the whole supplement rabbit hole, especially if this can be helped with just an anti-inflammatory diet, getting sunlight, etc. Start there before spending tons of money on supplements. Mr. Specimen, I was prescribed Paxil for panic disorder. I have a bit of respect for the side effects at the beginning of therapy. Can you say something about it? Thanks. Yeah, so Paxil for panic disorder. I have a video on Paxil and I get a little bit of, I guess you could say, backlash, as far as the fact that I call it the worst antidepressant. When in fact, it works very, very, very well. Especially for anxiety, especially for panic disorder, absolutely. My beef with Paxil is that it has a lot of side effects that he's talking about, especially in the beginning, one of the worst to tolerate. So most anyone who starts Paxil will have like stomach discomfort, dizziness, headaches, nausea. I've had a patient who just vomited on it in the beginning and was not able to tolerate it. So a lot of issues with that. If you're able to get past the first week or two, of course, then it could really be effective for you. But then the other thing about Paxil that no one really talks about is that it's one of the worst of the antidepressants to come off of. And thankfully, they do make it in liquid form, so you can really titrate slowly and all of that. But even though you go through, you know, the titration slowly, maybe you're doing a 5% reduction each month or whatnot, you will still have side effects. You will still have withdrawals, and they can be very significant withdrawals. So, you know, that's my beef with Paxil. That's why I don't prescribe it unless the person is adamant. Like the only times I prescribe it is they come to me and they say, I've been on Paxil, it worked for me, I want to get back on it. You know, I know in the beginning it's going to be hard, blah, 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 you know, and they want to start it and they understand these risks. But yes, Paxil can be very effective for anxiety, specifically anxiety, panic disorder, and even PTSD to a point, depending on the symptoms of PTSD that you have.